Hello, everyone. Thank you all so much for joining us. I know that everybody has enough going on as it is, enough on their minds, but we definitely feel it's imperative that we present some information to you guys just so everyone's on the same page. I know everybody probably has some questions. Hopefully, we'll address a lot of those questions in this webinar here. But I do encourage everybody to write their questions down, make notes, and either K-mail them to me after the webinar. Give me a call tomorrow this week. If you'd like, that's fine. I don't mind, discussing this over the phone, obviously, as well. But I just want to make sure that we are covering everybody's concerns and that the staff is taking the proper precautions for themselves and our patients. So please, K-mail, call me, whatever it may be with your questions. There may be stuff that we missed, that we forgot, we neglected to include in this webinar. So the more questions we get, the better. It's more helpful for everybody. I know everyone has a ton of information about this already. Obviously, it's coming from everywhere, but we definitely have a responsibility here to, as a healthcare company, to make sure that we're addressing this with you guys and you guys are addressing this with our patients, et cetera. So let's go ahead and dive right in. Again, I'll try to make it as short and sweet as I can here. So just a quick overview. Our patient precautions, what we should be telling patients, their families, their caregivers about the precautions that we're taking and the precautions that they should be taking. Staff precautions, how should our staff be dealing with this both personally and professionally, and our agency plan and precautions, what we're doing as an agency in response to this pandemic. So let's discuss our patients and what we can do to protect them. First and foremost there, make sure our patients understand the seriousness of this situation. I'm going to quote from a physician with the state of Michigan. And she said, it's not something that has two sides of the story. This is what the science and the evidence is telling us we should be doing. If we want to decrease the spread of the infectious disease, we need to limit the exposure. So for me, a big part of this whole thing, and as far as we go as clinicians, not me personally, obviously, but you guys as clinicians, us as a home healthcare company, we really have a duty to separate facts from opinion or fiction. There's a lot of misinformation going around on social media and elsewhere, word of mouth, that I think it's vital that we make sure that our patients understand the facts. I'm sure that some of you have seen this post going around on Facebook where it says if you gargle with salt water or something like that, a certain amount of hours after contracting the virus, that it kills it in your throat. Actually, a church in Korea did this, and 47 of their churchgoers ended up getting the virus. So there's things like this going around, and that's why it's important for us and really everybody to make sure that people understand the facts. Now, obviously, we want to reassure our patients not to panic in this situation, but we also have to find that middle ground of not panicking and understanding the seriousness of what's going on. They also need to understand why they should be adhering to the government's guidelines and the government recommendations as far as staying home, isolating, those kinds of things. We'll get into that a little bit further, but I want to make sure that everybody understands this and that our patients understand that it's not that you're going to walk outside, get the virus, and die the next day. What this is about is protecting our healthcare system. If we don't take the measures that the government is implementing, we get a huge influx, a huge spike in cases. All those cases are rushing to the hospital. The hospital gets overloaded. And we see what's happening in Italy and I think a couple other countries around the world. What's happening at this point is their hospitals are just overran. They don't have the necessary equipment to treat patients. They don't have the necessary amount of staff to treat patients. And they're in a situation now, I believe, where they're having to literally decide who's going to get treated and who isn't. So it's a very tough situation in Italy. It's a very sad situation, and that's why the government's taking the steps that they're taking so we can try to avoid a disaster like that. And again, it's I think our duty just as citizens, let alone healthcare professionals, to make sure that patients, families, caregivers understand this. Everybody around you should understand the reasons why the steps that are being taken um, are being taken. So please do your best to educate our patients. Use the information that we sent out to educate our patients. You know, we mailed out a packet of information to most of you that details what to discuss with patients, as well as some informational flyers from the CDC that you should be handing out to patients. I'm going to be creating a Google Drive folder for you guys to be able to access those flyers, any other information that I kind of deem necessary. You guys can access them from your phones, from your computers. You can print them out. You can email them, all that good stuff. So it'll be available to you guys, and I'll send that link out in a K-mail to everybody, so you guys will have that either today or tomorrow. I'll send that out. And also on on educating our patients on that first point, I just want to point this out. I heard this, and it's a really good approach to take. A good rule of thumb to follow in this situation: assume you already have the virus. Don't live as though you're trying not to get the virus, but that you already have it and you're trying not to spread it to anybody else. I think that's a good rule of thumb to follow, and you can convey that onto your patients as well. It's a really good kind of outlook to have, or method to take in this situation. Next point is helping patients understand their risk level. In that, that packet that I sent out to you guys, I did include assessing risks and stuff for patients, helping them understand, and we need to encourage them, whether we're going through it with them or not, encourage them to review the information that we leave them, and again, help them understand their individual risk level. If they have existing conditions that that could result in more complications from getting the virus, those kinds of things, we need to make sure our patients, especially the high-risk patients, are understanding that. The next thing here is, of course, encouraging to wash their hands. Instruct them on how to properly wash their hands. Review the proper hand washing techniques. I mean, you guys are all pros at that by now. So that's one of the biggest things everybody can do. So encourage them to wash their hands, soap and water. You guys all know that better than I do, I'm sure. The next thing here is helping them understand the need to stay home if they're sick, besides receiving medical care, obviously. We need to make sure that they understand the importance of staying home and limiting exposure to others. And I touched on that a little bit already, but we need to make sure that everybody understands that. Social distancing, we hear that term a lot, obviously. Encourage your patients and their family members to stay home in general during this time, as well as limiting visitors to their home, or asking questions to people that may be coming over, or make sure that their visitors are washing their hands as soon as they come in, or taking their shoes off, or whatever the case may be, taking any precautions that they can to prevent exposure to the virus. Another thing is self-monitoring. Encourage them to self-monitor if they feel they're running any risk or anything. Taking their temperature regularly if they're higher risk or showing symptoms. Another thing, obviously, self-quarantine. There's a lot of that going around right now, and this goes hand in hand with everything I've said. Our patients, if they're sick, should be quarantining at home in a room by themselves if they don't live alone. Encourage them to, if there is more than one person in the house, stay in a room, try to stay isolated. Make sure that they are disinfecting, if they don't live alone, again, make sure that they're disinfecting their high traffic areas, their places that are often, touched and things like that, faucets, doorknobs, those kinds of things. Make sure they're, if they're using Kleenex, they're throwing them right away, they're washing their hands regularly, they're wearing a mask, whatever the case may be. Again, you guys are very, I know that you guys are very, familiar with all these, protocols and prevention and control and stuff like that. I know that, but I just want to make sure that we remember to also communicate these things to our patients as far as this virus goes. And the last thing here, and again, there's a lot more information that I included in that mail packet, so I didn't want to review everything, but I wanted to make sure that that I covered this with you guys here. Some of these things here as well, but there's more detailed information in that mail packet as far as what to discuss with your patients. If you guys have any questions, let me know. But the last thing, tell patients to contact their doctor and us if they develop symptoms or they feel they may have come into contact with someone who has the virus. It's imperative that they do this. We want to make sure that that they're not waiting. Who knows? What if they're showing symptoms? They say, "Oh well, I have the nurse coming out tomorrow. Let's see what she says." That's not the steps that we want to take in a situation like this. Let's encourage our patients to contact their doctor and us if they develop symptoms, or again, if they feel that they may have come into contact with somebody who has the virus. Moving on, I wanted to make sure we noted this as well. How do we screen for COVID-19? I included the guidance for infection control and prevention concerning the coronavirus disease from CMS that we had received. Please review that, guys. There's not a ton of great information in there, honestly. I'm disappointed with the steps that CMS has taken so far. I think they're going to be doing more. It's been a really slow response in general, but we're hoping that we'll have more information for you guys. But let's get into this as far as screening goes. So this is pulled directly from that guidance. When making a home visit, home health agencies should identify patients at risk for having COVID-19 infection before or immediately upon arrival to the home. They should ask the patient the following. International travel within the last 14 days to countries with sustained community transmission. I'm sure the majority of our patients don't have that, but have they come into contact with somebody? As you'll see there in number 3. But number 2, signs or symptoms of a respiratory infection, fever, cough, sore throat. And then there, number 3 again, in the last 14 days, have they had contact with someone with or under investigation for COVID-19 or ill with respiratory illness, or somebody that's been traveling internationally within the last 14 days? Are they residing in a community where community-based spread of COVID-19 is occurring? These are the things you want to look for as far as a screening goes. If you suspect any of our patients have the virus, may have a risk of coming into contact with the virus, let us know. Let us know immediately, and we will follow the the necessary precautions and protocols that the state has provided us with. So moving along, what to do if you suspect a patient may have the virus. Obviously, just touched on this. For ill patients, implement source control measures. Again, this is direct from the CMS guidance. Placing a face mask over the patient's nose and mouth if that has not already been done. I'll get into the masks and stuff in just a bit, but that's what the CMS guidance is telling us to do, and also inform the home health agency clinical manager, local and state public health authorities about the presence of a PUI, person under investigation for COVID-19. We will handle the local and state authorities, but you'll have to just please let us know. We obviously need to let the doctors know as well. Moving along, protecting yourself. Huge emphasis on this, of course, everybody knows, but huge emphasis on this. If you are sick, stay home. Staff who have signs and symptoms of a respiratory infection should not report to work, should not be making visits. Obviously, this goes right back to what I said initially about containing the spread of this virus. If you are sick, please stay home. Call me, text me, let me know what's going on. We'll get your patients covered. Hopefully, everything is going to get back to normal eventually. But for the time being, if you are sick, please, please, please stay home. The next thing, just follow your usual protocols, of course. Make sure that you review that guidance that the CMS had provided us with, the infection control and prevention. but follow your usual protocols. This is nothing new for us. Again, for you guys especially, following infection control and prevention protocols is something that we should be doing. I hope we're doing on a, on a daily basis. But please make sure you're following them to a T. If you have any questions about our infection control and prevention protocols, please call Inga or K-mail her. I encourage you all to call. For situations like this, it's better to have a conversation over the phone. But please make sure you understand them. And again, if you have any questions on any of our infection control protocols and prevention protocols, please make sure you understand them. Call Inga and ask questions. Another thing is, let me jump back real quick on the infection control and prevention. According to the CDC, home health infection prevention strategies should focus on home infusion therapy, urinary tract care, respiratory care, wound care, and enteral therapy. So just want to make sure you guys know that. I mean, that's some of our higher risk patients. So just want to make sure everybody understands that. The next thing, let us know if you feel you may be at risk. This screening, the COVID screening, also applies to our staff, to us, to everybody. So let us know if you feel you may be at risk for contracting the virus, and then also let us know if you feel you may be a risk to patients. If you're a risk, then you're a risk to patients. And really, what I wanted to, one of the things I wanted to communicate, maybe not everybody has thought of this, but really, our clinicians, our staff, you guys are at greater risk to our patients than they are to you, even though they may be higher risk of contracting the virus. You guys are going out and seeing however many people in any given week, and then going and seeing individual patients, whereas they may not see more than 3-4 people in a week. So we're actually a greater risk to our patients. So that's why it's incredibly important that we're taking the necessary precautions. You guys are taking the necessary precautions, not just for your own safety and your own health, but for our patients' health and our patients' safety as well. So please let us know if you feel that you may be at risk. Follow those screening guidelines that I presented earlier. You guys do have those screening guidelines as well. I sent those out to everybody, and just let us know. And we're happy to help you guys in any way that we can. Again, we know it's a really difficult time, to just be involved in any of this. And we want to make sure that we are helping out everybody that we can, including our staff, of course. I mean, we love you guys, and we thank you guys for everything that you're doing. So moving along, what are we doing as an agency? First and foremost, we're taking inventory of our supplies, and we're ordering more. We're ordering as much as we can. Obviously, we have a decent stock of stuff right now. We think we're okay for the time being. Obviously, the supply companies are taking measures to prevent agencies and people from over-ordering, which I think is a great idea, because hospitals are already in short supply, and that's really the people that need this right now are the doctors and nurses in hospitals. But we are ordering more. We do have some stuff. If you guys need anything, please let us know. We don't have any N95 masks, although we are working on those for our patients that may potentially need them. But we do have surgical masks, which are effective. They're not as effective, but they are effective. We have a good supply of gloves. If you guys need anything, please let us know. Please let me know. Let Reem know. We'll send stuff out to you guys. The next thing is we shut down our office. Nobody is going to be going into our office just because we're trying to play our part. We only have 4 or 5 people there on any given day, but still, there's a lot that goes along with somebody getting to an office, going to a gas station, stopping at the grocery store on their way home, whatever it may be. We just want to try to contain this as much as we can. And again, we're just trying to play by the rules like everybody else. And really what the government's saying is if you can work from home, then you should. And we have the luxury of being able to do that with everything being online. So that's what we are doing at the time being. Obviously, I'm still able to go to the office for supplies. I have a decent stock of supplies at my house for the purposes of mailing them out and stuff like that. But our office is shut down. Now, the next thing is, we're obviously following the CMS guidance regarding suspected cases, of course. And I'm sure that the biggest question that everybody has is, are we going to be taking patients who have tested positive? Now, we've gotten this question from a few case managers. I'm sure that's the question on everybody's mind. At the moment, I'm going to just tell you guys that we have not made a decision yet. And the reason that we haven't made a decision yet is because I don't feel that the government, the CMS and the CDC have given us enough guidance on this situation and how we should be handling it. I've talked to a few people about this. It's really difficult. The government is telling people to quarantine, isolate, stay home, uh, but they still talk about what we should be doing if we're seeing a patient who has the virus. Now, for me, there needs to be clearer instruction and guidelines to follow from CMS, from the CDC. If we don't get patients, we don't get referrals for patients who have the flu, like the seasonal flu, right? Because there's only a whole lot that there's only so much that we can do. We can't treat them in the home really. They have to just follow their doctor's orders and let it run its course. Obviously, this is a bit different, but for those patients that are high risk, more than likely they're going to be in the hospital, number one. Number two, if a patient is not high risk, I mean high risk for complications from the virus, if they're not high risk for complication from the virus, what are we going to be seeing that patient for in the home? Maybe they have a wound or something like that. If they're under quarantine, I don't know how responsible it is for for a home healthcare agency to be going in and seeing patients and then seeing 5 more patients in that day or 6 more patients in that day. So at the moment, we have not made a final decision. I'm leaning towards no, because I think that that's the socially responsible thing to do. I don't think it's necessary for us to be putting our other patients into jeopardy, and of course our staff into a situation that could lead to them contracting the virus. It's very, very difficult for us to make a determination on this right now, but at the moment I'll tell you guys I'm leaning towards no, and until CMS gives us clearer guidance on this and CDC gives us clearer guidance on this and more detailed guidance on this, the answer is going to be no. And then last, helping our staff. Again, if we can be helpful in any way through all this, please let us know. I don't have any specific examples for you guys, but I know it's a very difficult time for everybody involved. I know it's a very difficult time for everyone in this country and everybody in the world right now, and we want to try to do our part with our staff and with their families. We'll help out in any way that we can. If you guys need anything, or if you think we could be helpful, just give me a call. Let me know, and we'd like to help out in any way that we can. And I don't know if people have been seeing this this meme floating around here. But a big, huge thank you to you guys for everything that you do. It's really, it takes times like this to really appreciate. You guys know that I appreciate you guys every day, but it takes times like this for most people to recognize what you guys in the healthcare world do. Our nurses, doctors, our therapists. You guys are playing a huge part in all of this. And of course, we want to play our part in this as well. Let's make an impact. Let's educate our patients. Let's do everything that we can to control the spread of this virus. Again, thank you all so much for all the work that you do. We appreciate you guys. And again, let me know if there are any questions. Mail me, call me tomorrow, whatever you guys prefer. Thank you all for joining. I really, really appreciate it. Hope this was helpful to you guys in offering some guidance as far as what we're doing and what you should be doing. So thank you all again so much. Cannot thank you enough. I really, really appreciate it. Everybody have a wonderful night, and I'm sure I'll talk to all of you soon. Thanks. Take care.